If you're taking something for allergies, insomnia, anxiety, depression, or even for your bladder, you have to be careful, because some of these drugs may be quietly increasing your risk of dementia. In fact, taking one of these very common pills daily for 12 months may raise your risk of dementia by 50%. And there's strong evidence from multiple large studies showing that these particular medications are linked to brain shrinkage and memory loss. These are not exotic or experimental medications. They're everyday medications that are probably sitting in your medicine cabinet right now. So, in this video, I want to walk you through what these drugs are and how they're silently harming your brain. And I'm going to go over safer alternatives that you can use instead. And by the way, if you have family members who are taking any of these medications, share this video with them, because there are so many people quietly damaging their brains and accelerating the onset of dementia without even knowing it. These drugs we have to be careful with are in a class of medications called anticholinergics, which is just a fancy word that means they block a brain chemical called acetylcholine. Acetylcholine is a vital neurotransmitter that acts like your brain's spark plug. It basically helps neurons talk to each other. You need acetylcholine to remember things, to pay attention, and even to move your muscles. So when you take these drugs for extended periods of time, it's like throwing a wrench into your brain's communication system. The brain signal gets weaker and weaker over time, and this is what leads to memory loss and dementia. Now, here's the important part. Anticholinergic drugs are in a lot of common medications. Here are just a few examples. Your allergy medications like Benadryl are anticholinergics. It's also found in many over-the-counter sleep aids like Tylenol PM or Unisom. Some anxiety medications fall in that class as well, such as hydroxyzine, also known by brand names like Vistaril or Atarax. A lot of bladder control medications like oxybutynin, ditropan, Detrol, or Vesicare also fall in that class. Many IBS medications like Bentyl and even your motion sickness patches like the scopolamine patch are also in the class of anticholinergics. Some of these are prescription medications and many are over-the-counter, but they all have the same brain-blocking effect. And there are multiple studies that show this. First, there was a systematic review and meta-analysis that looked at over 1.5 million people. It showed that anticholinergic drug use is an independent risk factor for all-cause dementia and Alzheimer's disease. It also showed that heavier anticholinergic drug exposure is associated with a higher risk of dementia. Then there was another concerning study, a meta-analysis of 21 studies, which showed that anticholinergic use for more than 3 months increased the risk of dementia on average by an estimated 46% versus non-use. A 46% increased risk just from 3 months of being on these medications. And there are many more similar studies that show this. There's one last study I want to mention from JAMA Neurology that looked at brain imaging and brain metabolism. It showed that the use of anticholinergic medications was associated with increased brain atrophy and brain dysfunction. So this isn't just about feeling groggy. These drugs change the shape and size of your brain, and they affect your brain's metabolism. Once you understand what's really happening in your brain, you'll see why these medications can be so harmful if you take them long-term. The key thing to understand is that in your brain, acetylcholine binds to receptors on neurons, specifically to muscarinic receptors. And this is what facilitates communication between brain cells. These muscarinic receptors play a crucial role in the parasympathetic. That's why these drugs are used to reduce symptoms like nausea, gut spasms, or an overactive bladder. But in the brain, these drugs block communication in areas like the hippocampus and the cerebral cortex, which are essential for memory and cognition. This is why these drugs can become a big problem. In the short term, they can cause brain fog, confusion, and slower reaction times. But with long-term use, this can eventually cause permanent damage and brain shrinkage. This is especially pronounced in the elderly, because as we age, our natural levels of acetylcholine already tend to diminish. So if you're taking a medication that further reduces acetylcholine activity, you're essentially just speeding up that decline. So what ends up happening is you're basically cutting off one of the brain's main lines of communication. And the longer that goes on, the more damage it causes. Having said that, how do you deal with this? I'm not saying these drugs should never be used. Taking one Benadryl for a night or two when you can't fall asleep is not ideal, but it's probably fine. Also, sometimes we have to use Benadryl for severe allergic reactions, and sometimes we have to take these drugs for urinary incontinence or irritable bowel syndrome. But what we want to avoid is taking these medications every day for months or years. This is especially important for people who may be at higher risk than others. So who are these higher risk groups? People over 60, people who already have memory issues, and people who take more than one of these anticholinergic drugs at the same time. That last situation is actually very common, and I see it all the time in my practice. A person might be taking hydroxyzine or Vistaril for anxiety. Then they take Benadryl or Unisom for sleep. And they may also be taking Ditropan for bladder control. Each drug blocks a little acetylcholine, but together they're actually shutting down major parts of the brain and the central nervous system. So here's what you do. First, go through your medicine cabinet and look at both prescription and over-the-counter pills. Search online or ask your doctor or your pharmacist if any of them are anticholinergic. Next, do not stop any of your medications or make any changes to your regimen unless you discuss this first with your doctor. Ask your doctor to see if you can be switched to any safer alternatives, especially if it's something that you need to be on long term. For example, for sleep, a non-anticholinergic alternative could be something like melatonin, ashwagandha, chamomile, or magnesium. And by the way, you have to be on the right form of magnesium for sleep. If you're not sure, I made a separate video on how to pick the best form of magnesium, and I'll post a link to that below. If you're using a prescription medication, something like trazodone has minimal to no anticholinergic effects and can be very helpful for sleep. Next, if you're suffering from allergies, then you want to lean into using second-generation antihistamines, drugs like Zyrtec, Claritin, or Allegra, as opposed to drugs like Benadryl, because they have minimal penetration into the central nervous system and the brain. Now, these second-generation antihistamines are still anticholinergic, but they're less likely to cause anticholinergic effects. Next, if you're taking bladder control medications like oxybutynin, Ditropan, Detrol, or Vesicare, then you need to ask your doctor about a non-anticholinergic option like mirabegron. And if you suffer from IBS and you've been prescribed a drug like Bentyl, then I would talk to your doctor about alternatives like peppermint oil. There are also other prescription medications that your doctor may choose, and a lot of it depends on whether your IBS is constipation predominant or diarrhea predominant. If you've been on these drugs for a long time, you do not need to panic, but you can start optimizing your brain health now by getting regular sleep and regular exercise. You also need to focus on reversing other risk factors that cause cognitive decline and dementia, things like insulin resistance, high blood pressure, and heart disease. Follow Dr. SYNAPSE for more useful health information. If this opened your eyes to what might be hiding in your medicine cabinet, don't just click away. Hit like so more people see this, subscribe to Dr. SYNAPSE, and turn on the notification bell so you don't miss future videos on brain health and medications. Drop a comment if you recognized any of these drugs in your own routine, and share this video with a friend or family member who takes pills for sleep, allergies, or bladder issues. You might be protecting their brain more than you realize. All right, I hope this was helpful. Stay healthy, take care of your brain, and I'll see you in the next video.